Hello, welcome to NP at MCDD channel. I'm Broadcaster Go, and today my team and I will be presenting to you on drug discovery of neglected disease. In today's news, we will be covering introduction to neglected diseases, selected neglected diseases, drug discovery, as well as organizations involved. Now I'll pass the time to Broadcaster Ruli.
Hi, I'm Broadcaster Ruling, so I'll be talking about what is a neglected disease. So, neglected disease are conditions that result in serious health problems among the world's poorest people. Most of the conditions are infectious diseases that are more prevalent in tropical climates, particularly in areas with unsafe drinking water, poor sanitation, poor living conditions, and little or no access to health care. Why do we call these diseases neglected? Diseases are said to be neglected if they are often overlooked by drug companies or by other instrumental in drug access, such as government officials, public health programs, and news media. Another reason neglected diseases are not considered high priorities as it do not affect people who live in developed nations.
Okay, thank you, Ruling, for the insightful news on neglected diseases. Today, we are very lucky to have Professor Wei with us. Professor Wei is an expert in malaria, which is one of the major neglected diseases. Let's welcome Professor Wei to our studio.
Hi.
So, Professor Wei, can you share with the audience one of the common neglected disease?
One major neglected tropical disease would be malaria, which is accounted for over 1 million deaths in
that's so
mostly
scary.
children and pregnant women in sub-Saharan Africa. Malaria is caused by a parasite and is transmitted by mosquitoes.
Ah, so since mosquitoes are everywhere, right? So it's very easy to get this. So what are some common signs and symptoms of malaria?
They are high fever, chills, profuse sweating, and headache.
Ah, okay. So are there any treatment for malaria?
Yes, artemisinin are used to treat malaria. However, there have been artemisinin resistance reported in Asia, which is becoming a problem.
Ah, so since they are resistant, so is there any other new medications available?
Yes, Medicines for Malaria Venture is a not-for-profit public-private partnership established as a foundation in Switzerland in 1999. MMV aims to develop medicines that are affordable, accessible, and appropriate for use in malaria endemic areas. They are also responsible for developing anti-malaria agents, collaborated with many including Novartis. They develop Coartem dispersible specifically for children. It works by interfering with parasite growth and kills the malaria parasite.
Ah, so thanks for the sharing, and thank you for the sharing, and I hope to see you again. Okay, so now let's pass the time to broadcaster Gracia and another sharing with Dr. Darryl. Thank you, thank you, thank you, thank you.
Hi. Now I would like to invite Dr. Darryl. Woo! Dr. Darryl, what is the infectious agent of dengue fever?
It is a viral infection.
Oh, really? How can dengue be transmitted?
Dengue is transmitted by the bite of an infected female Aedes mosquito and it affects infants, young children, and adults.
Even children? What are the signs and symptoms of dengue fever?
Common symptoms include fever and diarrhea and appear in 3 to 14 days after the infective bite.
So serious? Is there a cure for dengue?
Currently, there is no cure. However, the drug we have been developing works by targeting a certain component of the virus known as a protease.
Oh, thanks for the information. Thank you so much. In conclusion, there is slight acceleration during the past 12 years in new therapeutics development and registration despite the persistent insufficiency in drug and vaccine development for neglected diseases. Although there is an increased effort put into drug research for neglected diseases, there remains a huge gap in new drug development for them. Of the 1,556 new drugs approved between 1975 and 2004, only 21 were specifically developed for tropical diseases and tuberculosis, even though these diseases account for 11.4% of the global disease burden. The chances of a drug being brought to market for central nervous system disorders or cancer is 13 times greater than for neglected disease. All in all, there is an urgent need to develop and deliver new treatments for the world's poorest and most neglected patients.
Okay, so thank you, broadcaster Gracia. With this, we have come to the end of our news. And for more information, please stay tuned to the narrated PowerPoint published by MCDD at NP channel. Thank you and see you again.